Von Willebrand disease is a genetic disorder, and we've known about this for almost 100 years now. The original diagnosis was made in 1926 by Erik von Willebrand, a Finnish physician in Scandinavia. So we're almost at the 100th anniversary of this condition. So how does understanding the genetics help us manage this disorder? That's an important question. The gene for von Willebrand disease, von Willebrand factor, was discovered now almost 39 years ago in 1985 by a number of groups. And so since that time, we've learned much more about the genotype, the genetic characterization of patients with this disorder. And we now use that information to differentiate different subtypes of the disease. And that also influences the type of management that the patients receive, the types of treatment that they receive. There are three main subtypes of von Willebrand disease, types 1, 2, and 3. About 70% of patients have type 1 disease, so this is the commonest form, type 2 disease in about 30%, and then type 3 disease is rare. In Canada, there's probably in the region of maybe 90 or 100 patients with type 3 disease in total. We use genetics principally to confirm type 2 diagnosis, and we use it for family planning purposes in type 3 disease. The use of genetics in type 1 disease is still a challenge because we recognize now that this may involve more than a single gene, the von Willebrand factor gene, and other genes in the genome may be contributing to type 1 disease manifestations. So we're still learning. After 35 years or so, we understand much more about the genotype, but there's still things that we need to resolve. Over the past decade in particular, the use of genetic testing in von Willebrand disease has increased significantly. It helps us confirm the diagnosis in individuals, particularly with some types of type 2 disease, and it's very helpful for family planning in type 3 disease. We still have more things to learn about type 1 disease, as I've said previously. So we're now getting more genetic information about more patients with this disorder. This helps us a lot, but there are still some issues that need to be resolved. We use genetics to not only confirm diagnoses, but also to help understand what are the best treatments to give the different patients with the different subtypes of disease. The other thing that's going to be happening in the next few years, hopefully, is that there may be some new treatments for von Willebrand disease. And so it's possible that there will be an association between certain genotypes and what types of new treatments will be used in these patients. So although in the last while we've learned a lot about the underlying genetic basis of the disease, we're still learning, and there are new things that will be applied to help us manage these patients even better than we are now. There is no doubt that the biggest disease burden with von Willebrand disease is in reproductive age women. So women, during the time that they're having menstrual periods, some of these women, actually large numbers of these women, have heavy menstrual bleeding, which ultimately, if untreated, can lead to complications like iron deficiency, which produces a poor quality of life and really messes with these women's lives in a major way. So being aware of this problem for physicians across the spectrum, from family physicians to specialists, and ultimately the diagnoses which will be made by hematologists, is really important. Genetic testing can play part of that role for sure, but the most important thing, I think, is the awareness that women who have abnormal bleeding during their menstrual periods or who've experienced postpartum bleeding should be considered as possibly having von Willebrand disease, and they must be referred to a hematologist where the diagnosis could be established.